And just again, as a friendly reminder, if you could all come up and introduce yourself before your comments, 10 minutes total. You can't speak for more than 4 minutes.
Okay, great. Good morning. My name is Shelby Huffaker, and I'm here on behalf of the San Diego chapter of Americans for Safe Access.
Sorry, can each person introduce themselves? Thank you. Sorry.
Good morning, Daniel Schadler.
Blessed greetings, MEgain Erlise.
Thank you.
Sorry about that. I'm here on behalf of the San Diego chapter of Americans for Safe Access. We are part of a national nonprofit comprised of medical cannabis patients, caregivers, medical professionals, researchers, and stakeholders working to expand safe access to cannabis for therapeutic use and research. We appreciate the opportunity to comment on the county's draft Cannabis Environmental Impact Report. I will be speaking to decision point number 1, land use, and our position is option A, align with state standards. First, aligning with state standards ensures equitable and sufficient access for medical cannabis patients. A wide range of national and international health agencies now recognize the therapeutic potential of cannabis. In California, roughly 5% of residents, or about 1.9 million people, are registered patients. Applying that rate locally suggests around 25,000 patients in the unincorporated county alone. For these residents, cannabis should be as accessible as other medications. Expanding buffer distances or creating additional sensitive use categories would shrink access in exactly the areas where patients need it most. For example, adding residential care facilities as sensitive uses would disproportionately hurt older adults, palliative care patients, and people with limited mobility, the very groups most likely to benefit therapeutically. It also conflicts with state law, which requires these facilities to allow patients to use medical cannabis that they purchase. Second, aligning with state zoning standards is necessary for the success of the county's socially equitable cannabis program. A 1,000-foot buffer would dramatically shrink the number of viable parcels for operators, especially when combined with overly broad definitions of sensitive uses. Under current county criteria, parks can include trails, easements, community centers, open space preserves, ecological reserves, and even county-managed landmark sites or monuments, effectively excluding large geographic areas from eligibility. Similarly, treating places of worship as sensitive uses is problematic because they can be opened quickly in private residences, and not all faith traditions object to cannabis. For equity operators with limited capital and fewer opportunities to relocate or litigate, such restrictions could be devastating. Aligning with state standards is necessary to uphold the county's stated equity commitments. Finally, aligning with state standards supports public health and economic goals. California's unregulated market still dominates sales. Expanding the regulated market improves product safety, reduces underage access, and increases tax revenue. Research also shows that legalization has not increased youth cannabis use, and cannabis can reduce consumption of more harmful substances like opioids and alcohol. For all of these reasons, we urge the board to adopt option A and align zoning requirements with state standards. Thank you for your time and consideration. I will now pass it over to the next speaker, Daniel Schadler, to talk about our position on decision point number 2.
Good morning, Chair and members of the board. Thank you for the opportunity to speak today. I'm a resident of District 4 and have worked in the legal cannabis industry for the last 8 years. I'm here to strongly support option A, focusing on lounges and regulated events for patients. Many patients live in apartments, shared housing, or a family where consuming of cannabis at home isn't possible. Lounges provide a safe and legal space for patients to consume cannabis responsibly without fear of eviction or fines. Lounges and events offer critical hands-on education. Patients can learn about dosage, product types, and alternative consumption methods, helping them use cannabis safely and effectively. Option A ensures patients a safe place to consume cannabis within our communities. We urge the board to move forward with the option. Thank you.
Chair and Supervisors, blessed greetings. Thank you for your time and your service. My name is MEgain Erlise. I'm a San Diego County resident and combat veteran, and I'm here because I love my community. I also serve a Roll Up for Equity, a community effort hosted by San Diego Americans for Safe Access, San Diego Normal, and the Blue Dream Democratic Club. We gather resident voices on equity and proximity because too many decisions are made like our neighborhoods won't accept regulated cannabis, when the truth is we will accept regulation. What we won't accept is a model that extracts from our community instead of repairing it. I grew up here during the war on drugs. I watched my streets get treated like hunting grounds. I watched households reorganize around absence, one less adult, one less paycheck, one more kid trying to be strong too early. People were taken in their teens and 20s, the years that form your judgment, your confidence, your direction, the years that decide the kind of adult you get to be. And the whole neighborhood had to live around the empty space they left, raising kids in the gaps. Now cannabis is legal and profitable. But legalization without repair is just a new economy built on the old wound. If the communities that carry the enforcement are still last in line for ownership, last in line for investment, and last in line for opportunity, then we have not moved forward in any real way. That is why on agenda item 3, I'm asking you to continue developing the county's socially equitable cannabis program and continue developing the CECP community incentive grants. Keep building it with urgency and follow through. And I want to be specific about land use. I support the state-aligned 600-foot buffer. Here's why. Because sitting rules decide whether equity is real or just theoretical. A buffer that wipes out most viable locations becomes a silent ban. The 600-foot standard keeps protections for youth-serving spaces, but it also opens up realistic locations so cannabis businesses can be in neighborhoods they're meant to serve. Hiring from those neighborhoods, operating compliantly there, and generating tax revenue that can be reinvested back into the same communities that were most impacted by the war on drugs. Equity businesses shouldn't be pushed miles away from the people and places they're supposed to strengthen. If the county is going to talk about community benefit, then make it something we can verify, define it, require proof, report it publicly, enforce it, and build this program so equity applicants can survive it. Predictable timelines, realistic pathways to compliant locations, and practical support, because a door that's technically open but practically locked is not access. When equity businesses can open legally, then benefits are not theoretical. There's local hiring, tax revenue, reinvestment, safer corridors, stronger families, and a lift in morale when people finally see dollars returning instead of people disappearing. This is how you can change the environment our children grew up in. You don't get credit for intention. Intentions don't rebuild families, outcomes do. Our neighborhoods paid into a system that took people and left trauma behind. Now it's time to balance the ledger. Continue SECP and CECP. Make community benefit enforceable and make reinvestment in impacted neighborhoods a fact, not a promise. Thank you.